Describe your experience in caring for pregnant women and newborns.
In my nursing career, I have gained significant experience in caring for pregnant women and newborns, ensuring that both mother and baby receive comprehensive, compassionate care throughout the entire process. From the prenatal period to postpartum care, I have worked closely with expecting mothers, providing education on prenatal health, monitoring fetal development, and addressing any concerns or complications that may arise during pregnancy. I prioritize patient-centered care, which means I take the time to understand each woman's unique needs and tailor my approach accordingly. During labor and delivery, I assist in monitoring the mother's vital signs and the baby's condition, and I provide support in managing pain and discomfort. I have also been actively involved in labor coaching, reassuring mothers through the birthing process and ensuring that they are informed and comfortable every step of the way. I work in collaboration with obstetricians and midwives to create a smooth and safe delivery experience. After the birth, my role extends to caring for the newborn and supporting the mother in her recovery. I conduct routine assessments on newborns, such as monitoring vital signs, checking for any signs of complications, and ensuring that the baby is healthy and thriving. I also help mothers with breastfeeding, offering guidance on proper techniques and addressing any challenges they may face. Additionally, I provide essential postnatal education to parents on newborn care, including bathing, feeding, and recognizing early signs of illness. Throughout my experience, I have developed a deep understanding of the emotional and physical challenges that both mothers and newborns face. I am committed to providing empathetic, holistic care that promotes the well-being of both. My goal is always to ensure a positive, safe, and nurturing environment for the mother, the baby, and the family during this critical time.
What is your understanding of the role of a nurse in preventing postpartum complications?
My understanding of the role of a nurse in preventing postpartum complications is centered on vigilance, patient education, and timely intervention. Nurses play a crucial role in monitoring the health of both the mother and the newborn during the immediate postpartum period, which is critical for identifying and addressing any complications early on. We are trained to observe for signs of postpartum hemorrhage, infection, deep vein thrombosis, DVT, preeclampsia, and other potential complications that can arise after childbirth. One of the primary responsibilities is to monitor the mother's vital signs, uterine tone, and bleeding, ensuring that these are within safe limits. Any abnormalities, such as excessive bleeding or an abnormal rise in blood pressure, require immediate action, and the nurse is often the first to detect these changes. Nurses are also instrumental in assessing the mother's emotional well-being, as postpartum depression or anxiety can emerge during this period. Recognizing early signs and providing the necessary resources or referrals is key to managing these conditions before they escalate. Another essential role involves educating the mother on how to care for herself once she is discharged from the hospital. This includes teaching her to recognize signs of infection, such as fever or abnormal discharge, and when to seek medical help if complications like heavy bleeding, pain, or swelling occur. Additionally, nurses provide guidance on maintaining proper hygiene, managing discomfort, and promoting healing, especially if the mother has had a cesarean section or an episiotomy. In breastfeeding, nurses play a pivotal role in preventing complications such as mastitis or issues related to poor latching by offering proper guidance and support. By ensuring that mothers are equipped with knowledge and resources, we empower them to take proactive steps in their recovery. Overall, a nurse's role in preventing postpartum complications is multifaceted, combining clinical skills, patient education, and emotional support. Our goal is to ensure that both the mother and baby transition smoothly into this new phase, minimizing risks and promoting a healthy recovery.
How do you approach patients with sensitive gynecological concerns?
When approaching patients with sensitive gynecological concerns, my primary focus is to create a supportive, respectful, and non-judgmental environment where the patient feels safe and comfortable. I recognize that these issues can be deeply personal and often evoke feelings of vulnerability, so I ensure that my approach is empathetic, patient-centered, and guided by clear communication. I begin by establishing trust through active listening and maintaining a calm, compassionate demeanor. It's important that the patient knows their concerns are being heard and valued, and that I am there to support them, not just clinically but emotionally as well. I am always mindful of the patient's comfort, ensuring that they feel in control of the conversation, which includes giving them the space and time to express their concerns at their own pace. I use open-ended, non-intrusive questions to encourage dialogue, while also being sensitive to signs that they may not be ready to share certain information. Confidentiality is crucial in these situations. I make it clear to the patient that their privacy is of the utmost importance and that all discussions and information will be handled with strict discretion. This reassurance helps to build a trusting relationship and allows the patient to open up without fear of judgment or embarrassment. I also provide clear explanations of any procedures or treatments, ensuring the patient understands what will happen and why. This is particularly important with gynecological issues, as it can help alleviate anxiety. I take care to offer options and involve the patient in decision-making, giving them a sense of agency over their own healthcare. In cases where patients may feel uncomfortable or anxious, I prioritize emotional support, often suggesting additional resources, such as counseling, if needed. My goal is always to empower patients, ensuring they feel respected and supported in addressing their sensitive concerns. Overall, I approach these situations with sensitivity, professionalism, and empathy, fostering a trusting relationship that prioritizes the patient's comfort and well-being.
Describe a challenging situation you encountered in obstetrics and gynecology nursing and how you handled it.
One particularly challenging situation I encountered in obstetrics and gynecology nursing involved a patient who was experiencing severe postpartum hemorrhage after delivering her baby. This is a potentially life-threatening condition, and time is of the essence in such cases. The situation became more complex as the patient was extremely anxious and had underlying health conditions that increased her risk of complications. As soon as I noticed that her bleeding was excessive and not within normal limits, I immediately alerted the attending physician and initiated emergency protocols to stabilize her. I began by monitoring her vital signs closely, ensuring that her blood pressure and heart rate were tracked continuously. I administered prescribed medications to help contract the uterus and minimize blood loss, while preparing for potential interventions such as blood transfusions. Throughout this process, communication was key. I kept the patient informed about what was happening in a calm, reassuring manner, which helped ease her anxiety. I also communicated regularly with the healthcare team, ensuring that everyone was updated on her condition and that any necessary resources, such as blood products, were ready in case her condition worsened. At the same time, I was mindful of the emotional toll the situation was having on both the patient and her family. While I worked to stabilize her physically, I also took time to provide emotional support, speaking with her family to explain the situation and reassure them that we were doing everything possible to manage the bleeding. Fortunately, after several interventions, the bleeding was controlled, and the patient's condition stabilized. In the following days, I continued to monitor her closely, ensuring that she recovered without further complications. I also provided her with additional support and education on postpartum care, helping her understand the warning signs to watch for and encouraging her to ask questions. This situation requires quick thinking, collaboration with the medical team, and a strong balance between clinical care and emotional support. It reinforced the importance of remaining calm and focused under pressure while maintaining compassion for patients and their families during critical moments.
What is your experience with performing gynecological examinations?
In my nursing practice, I have gained extensive experience performing gynecological examinations, both in routine screenings and in addressing specific concerns. My role involves ensuring that these examinations are conducted with precision, professionalism, and sensitivity to the patient's comfort and emotional well-being. Before beginning the exam, I always make sure to explain the procedure to the patient in detail, answering any questions they may have and ensuring they feel informed and at ease. This step is critical, as many patients may feel anxious or uncomfortable about the examination, particularly if it's their first experience. I reassure them that their privacy will be respected and that the process will be conducted with the highest degree of care and confidentiality. During the examination itself, I take care to maintain clear communication, explaining each step as it happens to minimize any uncertainty or fear. Whether it's a routine pelvic exam, a pap smear, or a more specific procedure like the collection of a swab for infection screening, I approach the examination with a focus on gentleness and sensitivity, ensuring that the patient is as comfortable as possible. I also pay close attention to the patient's verbal and nonverbal cues throughout the process, adjusting my approach based on their level of comfort. For patients who may have had previous trauma or anxiety related to gynecological exams, I adopt an even more empathetic approach, allowing them to guide the pace and giving them the option to pause or stop if needed. Once the examination is complete, I take time to discuss any findings with the patient and provide education on reproductive health, including preventive care, contraception options, and addressing any concerns they may have. Follow-up care is also an important part of my role, ensuring that patients understand the next steps, whether that's reviewing test results or scheduling additional appointments if needed. Overall, my experience in performing gynecological exams has taught me the importance of combining technical skill with a compassionate, patient-centered approach to ensure that each individual feels respected, informed, and supported throughout the process.
What is your experience with caring for patients with gynecological cancers?
My experience caring for patients with gynecological cancers has deepened my understanding of the importance of comprehensive, compassionate, and specialized care. Gynecological cancers, including ovarian, cervical, uterine, and vulvar cancers, require a multifaceted approach that addresses both the physical and emotional challenges patients face during diagnosis, treatment, and recovery. From the initial diagnosis, I work closely with patients to provide education and emotional support, helping them understand their condition and the treatment options available. This often includes explaining complex medical procedures like biopsies, imaging tests, and surgical interventions in a way that is clear and reassuring. I understand that the uncertainty and fear that come with a cancer diagnosis can be overwhelming, so I prioritize building a trusting relationship where patients feel comfortable asking questions and expressing their concerns. During treatment, I provide hands-on nursing care that includes monitoring for side effects from chemotherapy, radiation, or surgery, as well as managing pain and other symptoms that arise. For example, in patients undergoing chemotherapy, I monitor for common side effects like nausea, fatigue, and neutropenia, ensuring that interventions are in place to minimize discomfort and reduce the risk of infection. For patients recovering from surgery, I assist with postoperative care, including wound management, pain control, and mobility support, while educating them on how to care for themselves at home to prevent complications. Equally important is the emotional and psychological support I offer. I have found that patients dealing with gynecological cancers often face unique emotional challenges related to body image, sexuality, and reproductive health. I provide a compassionate and non-judgmental space where patients can discuss their feelings, fears, and concerns, and I connect them with additional resources like counseling or support groups when needed. I also collaborate closely with the broader healthcare team, oncologists, surgeons, radiation therapists, social workers, and palliative care specialists, to ensure a coordinated and patient-centered approach. In cases where the cancer is advanced, I work with the palliative care team to focus on pain management, symptom relief, and improving the patient's quality of life. This involves not only addressing physical symptoms but also supporting patients and their families through the emotional and psychological aspects of end-of-life care. Throughout my experience with gynecological cancer patients, I have learned the importance of being adaptable, as each patient's journey is unique. My goal is always to provide holistic care that addresses not just the medical aspects of the disease but also the emotional, psychological, and social needs of the patient. By offering compassionate support, clear communication, and attentive nursing care, I strive to improve both the patient's quality of life and their overall experience during such a difficult time.
How do you approach patients with fertility concerns?
When approaching patients with fertility concerns, my priority is to create a supportive, empathetic, and non-judgmental environment. I understand that fertility issues can be emotionally challenging, often associated with stress, anxiety, and sometimes feelings of grief or frustration. Therefore, my approach is grounded in sensitivity, clear communication, and providing holistic care that addresses both the physical and emotional aspects of the patient's concerns. First, I begin by actively listening to the patient's story, ensuring that they feel heard and understood. Fertility issues are deeply personal, and patients need the space to express their concerns, fears, and questions in a safe environment. I take care to use open-ended, non-intrusive questions, allowing the patient to share as much as they feel comfortable, while being mindful not to rush them or make any assumptions about their experience. Education is an essential part of my role when addressing fertility concerns. I provide clear, evidence-based information about fertility, potential causes of infertility, and the available diagnostic tests or treatments. This may include explaining options such as hormone testing, ovulation tracking, or imaging studies like ultrasounds to assess reproductive health. If needed, I also discuss more advanced options, such as fertility treatments like in vitro fertilization, IVF, intrauterine insemination, IUI, or other assisted reproductive technologies, ART. It's crucial to acknowledge the emotional toll that fertility challenges can take. I offer emotional support throughout the process, encouraging patients to discuss their feelings and concerns openly. For those who are struggling emotionally, I may suggest counseling or support groups to help them navigate the emotional complexities that often accompany fertility struggles. I recognize that dealing with infertility can impact relationships, self-esteem, and mental health, so I am always attentive to these aspects of care. Collaboration with the broader healthcare team is also an important component. I work closely with fertility specialists, gynecologists, endocrinologists, and other healthcare providers to ensure that the patient's care is comprehensive and well-coordinated. This team-based approach ensures that all aspects of the patient's fertility journey, from diagnosis to treatment, are managed in a seamless and supportive manner. Throughout the process, I remain a source of continuous support and guidance, offering reassurance when treatments feel overwhelming or when results are not as expected. My aim is to empower patients by providing them with the knowledge, emotional support, and resources they need to make informed decisions about their fertility options. In summary, my approach to patients with fertility concerns is centered on empathy, education, and holistic care. I work to ensure that each patient feels heard, respected, and supported as they navigate this deeply personal and often challenging journey.
How do you stay up to date with the latest advancements in obstetrics and gynecology nursing?
Staying up to date with the latest advancements in obstetrics and gynecology nursing is essential to providing the best possible care to my patients. I make this a priority by engaging in continuous professional development through a variety of methods. One of the key ways I stay informed is by regularly attending conferences, workshops, and seminars related to obstetrics and gynecology. These events offer valuable opportunities to learn from experts in the field, explore new research, and gain insights into emerging technologies and treatments. Whether it's a local workshop on fetal monitoring techniques or a larger international conference on maternal-fetal medicine, these experiences help me stay at the forefront of developments in this specialized area of nursing. I also stay current by reading peer-reviewed medical journals such as Obstetrics and Gynecology, the Journal of Midwifery and Women's Health, and the American Journal of Obstetrics and Gynecology. These publications offer in-depth articles on the latest research findings, clinical practices, and case studies, allowing me to apply evidence-based knowledge in my daily practice. I make it a habit to review new issues of these journals and to research topics that are directly relevant to my work. In addition to formal education, I am part of several professional organizations, such as the Association of Women's Health, Obstetric and Neonatal Nurses, AWON. Being a member of these organizations gives me access to newsletters, updates on policy changes, and continuing education resources that are tailored specifically to obstetrics and gynecology nursing. I also participate in online forums and discussion groups, which allow me to exchange experiences and insights with colleagues from different regions and healthcare settings. This peer collaboration is especially valuable for sharing best practices and staying updated on real-world applications of new techniques or guidelines. To further expand my knowledge, I actively pursue continuing education courses and certifications. For example, I maintain certifications in areas such as Advanced Cardiac Life Support, ACLS, and Neonatal Resuscitation Program, NRP, both of which are critical for managing emergencies in labor and delivery. I also take courses related to high-risk pregnancies, reproductive health, and advancements in fertility treatments. These courses not only deepen my expertise but also ensure that my skills are aligned with current best practices and standards of care. Finally, I collaborate closely with other healthcare professionals in my workplace, such as obstetricians, midwives, and nurse practitioners. We share knowledge and discuss complex cases, which often leads to valuable insights on applying the latest research and guidelines in practical clinical settings. In summary, I stay up to date with advancements in obstetrics and gynecology nursing by attending professional events, reading relevant medical literature, being involved in professional organizations, pursuing continuing education, and collaborating with colleagues. This ongoing learning process ensures that I can provide the highest standard of care based on the latest evidence and innovations in the field.
What is your experience with caring for high-risk pregnancies?
My experience caring for high-risk pregnancies has been both extensive and rewarding, as it has deepened my understanding of the complexities involved in maternal and fetal health. High-risk pregnancies require a heightened level of vigilance, advanced clinical skills, and personalized care to ensure the well-being of both the mother and the baby. Over the years, I have worked with patients experiencing a variety of complications, including gestational diabetes, preeclampsia, multiple gestations, preterm labor, and maternal health conditions such as hypertension, heart disease, and autoimmune disorders. From the moment a pregnancy is identified as high risk, I become actively involved in providing close monitoring and continuous support. I collaborate with obstetricians, maternal-fetal medicine specialists, and other healthcare professionals to create individualized care plans tailored to each patient's unique needs. My role involves frequent monitoring of the mother's vital signs, fetal heart rate, and other indicators that could suggest complications. For example, with patients at risk of preeclampsia, I regularly monitor blood pressure and watch for symptoms like severe headaches or changes in vision, while keeping the healthcare team informed of any abnormalities that may require immediate intervention. Managing gestational diabetes is another area where I have significant experience. I work closely with patients to monitor blood glucose levels, educate them on dietary management, and ensure they understand the importance of maintaining tight control to reduce risks to both the mother and the baby. In some cases, I assist in administering insulin or other treatments as needed, ensuring that the patient feels supported and confident in managing her condition. For patients at risk of preterm labor, I am vigilant in recognizing early signs such as uterine contractions, cervical changes, or ruptured membranes. In these situations, I assist in administering medications to delay labor, such as tocolytics or corticosteroids to enhance fetal lung development, while providing emotional support to the mother. If delivery is inevitable, I help prepare the family for the challenges of premature birth, coordinating care with the neonatal team to ensure the baby receives immediate and appropriate care upon delivery. I also provide significant emotional and psychological support to mothers facing high-risk pregnancies. These situations can be stressful and anxiety-inducing, particularly when complications arise or hospitalization is required for prolonged monitoring. I take the time to explain procedures and conditions in a clear and compassionate manner, ensuring that the patient and her family understand what is happening and feel empowered to make informed decisions about their care. I recognize that high-risk pregnancies often involve significant uncertainty, and I am committed to providing reassurance and addressing any emotional concerns that arise. Postpartum care is equally critical for mothers who have experienced high-risk pregnancies. I continue to monitor for potential complications, such as postpartum hemorrhage or infections, and ensure that both the mother and baby are stable before discharge. Additionally, I offer education on how to care for themselves and their newborns after returning home, focusing on early signs of complications and providing guidance on recovery and follow-up appointments. In summary, my experience with high-risk pregnancies involves a combination of advanced clinical care, constant monitoring, patient education, and emotional support. By working closely with the healthcare team and providing compassionate, personalized care, I strive to ensure that both the mother and baby have the best possible outcomes, even in challenging and complex situations.